So welcome everyone. Thank you. It's being recorded now. So welcome everyone. My name is Girish Gupchap and I work for the SIU system. And we have today with us Jessica Ulrich, who is the Director of Counseling Services at SIUE. And then we have Jamie Clark, who is the Director of Student Health Services at SIUC, and Dr. Susan Hingle, who's the Associate Dean for Human and Organizational Potential and Chair of the Department of Medical Humanities at the School of Medicine. This is a workshop we're putting on student wellness. This was a workshop that's requested by the Student Advisory Committee for the SIU system. And that committee is made up of the constituent heads of the student bodies on all the SIU campuses. So thank you to the committee, and thank you to all our participants today that will be doing the program. And so with that, I will hand over to whoever is going to begin. I believe it's going to be Dr. Clark. Are you beginning or?
Dr. Ulrich's going to start us off.
Okay, all right. So thank you guys, everyone, for joining us. We're here to talk a little bit about understanding the needs of our learners. And so we're going to break this up into two separate segments. The first session will be until about 12:30, and the second will be breakout sessions in which each one of our institutions will talk about separate services available at each of our places. And so what we're going to do in terms of the first session that we're going to do, we're going to discuss a little bit of the overview of stressors that are impacting students, some of the trends that each of us are seeing on our campuses, as well as tools to best assist students. And then in the breakout session, each campus will discuss resources available to students, and we're hoping to also brainstorm some ideas for improvement. So to kick us off for the first section, we're going to talk a little bit about the mental health issues that we're noticing on campus. And there's been a national trend that mental health issues are on the rise across all campuses. And our system is definitely no exception to that. And with the mental health concerns and issues that we're noticing, if you look on here, this slide talks about a New York Times article from 2010. And in that article, it talked about in the year 2000.
Hello, sorry, I was on mute.
16% of students were experiencing psychological problems, and it rose for the decade later. 44% were experiencing severe psychological problems. And so as you can see, that was as far back as over a decade ago. And currently, if we look at the National Survey of Counseling Center Directors, in 2019, some of the major concerns that students were experiencing ranged from suicidal ideation all the way down to severe depression, eating disorders, self-injury, complex trauma. And so, as you can see, many of those concerns are definitely pretty significant psychological stressors. And we're noticing that even today. And so what we've noticed in the past couple of years is that the severity of concerns is definitely rising. So severity, I would say complexity, all at the same time. So we're having more and more students that are experiencing drug and alcohol symptoms leading to blackouts, tons of financial stress, leading from housing insecurity to food insecurity, a lot more significant suicide ideation, followed by attempts as well, resulting in multiple hospitalizations. And along with that, significant distress tolerance concerns with irritability, tension, a lot of racing thoughts that all negatively impacts their ability to perform their academic responsibilities. And so when we look at this, it's important to recognize what types of things we might be noticing in the classroom. And a lot of these bullets on here are just some of the examples that students can be experiencing, ranging from physical, psychological, and emotional concerns. And so they can be manifested in poor attendance or perhaps physically hygiene concerns, physical appearance changes, looking more unkempt, tired, restless, and then also behaviorally having concerns such as, not turning in assignments or communication challenges, disorganization, sometimes having more grandiose comments or what some faculty may describe as behavioral challenges. And those can definitely be some of those signs and symptoms that people may be having. So it's important to recognize some of those so that way we can intervene at the earliest point to prevent the symptoms from exacerbating.
I'm going to take over the next few slides. One of the most significant things that's happened over the past couple of years, not surprisingly, is the pandemic. And that pandemic has had both acute and long-term impacts on really all facets of our lives. And a lot of those can be manifested or are manifested through our mental health. This slide comes from the Kaiser Family Foundation, and they looked at the number of adults who reported any symptoms of anxiety or depression. And pre-pandemic, it was right around 11%. Right in the heart of the pandemic, it was 41%, so very high. They did some follow-up pulse surveys and found in February of 2022, so a little over a year ago, that had dropped to 31.5%. So it was trending in the right direction. They just repeated that pulse survey again in February of this year, and it was at 32.3%. So it's not continuing to improve, but it leveled off. So not as high as it was in 21, but much higher than it was pre-pandemic. Next slide. So this is another way to look at that. They were able to break this down based on age. And it seems that younger people were much more affected by the pandemic in relation to mental health. This slide comes from 2020, and you can see that college-age students 18 to 24 were at 56.2% reporting symptoms of anxiety and or depression, and 24 to 49 was at 48.9%. They again repeated this in their pulse survey in February of this year, and that age 18 to 24 had gone down from 56% to 50%. So a little bit of improvement. And adults ages 25 to 49 has gone down from 49% to 38%. So trending in the right direction, but still very, very significant and concerning. Next slide. The other thing that happened throughout the pandemic was it really exposed really significant inequities in our society, in our social structures. And there was a lot of unrest that happened because of that. There was a lot of disparate outcomes from the pandemic from that as well. And so you can see on this slide also from the Kaiser Family Foundation the disparate impact that COVID had on our communities of color. You can see that if you take all adults, it was at 42.4%. If you looked at non-Hispanic whites, that was 40.9%. If you looked at our communities who identify as Hispanic or Latino, it was 46.3%. Our non-Hispanic blacks, it was 48%. So you can see that there was really a much more significant impact of the pandemic on people of color. Next slide. So Jessica had started to talk about how suicidality has become more common, and here are some statistics that come from the Center for Disease Control. 11% of all adults have contemplated suicide in the last 30 days. That's up from 4% pre-pandemic. People who were identified as essential workers, so people who worked in our hospitals, worked in our grocery stores, really frontline folks who did not have any real sense of control over their health and their lives, that was up at 22%. 25% of all essential workers either started or increased alcohol and drug use since the beginning of the pandemic, and that was compared to 11% of all adults. And as Jessica talked about, we've also seen a significant increase within our campuses, and there has been an increase in student hospitalizations on both the Carbondale and Edwardsville campuses since the start of the pandemic. Next slide. So a lot of this is not surprising when you look at how the pandemic upended our lives. And now we're in the throes of the follow-up to that. There's been a lot of people who aren't working any longer, have left the workforce. So the people who remain in the workforce are working harder, higher demands, increased workloads. They feel very overworked. Couple this with the financial impact of the pandemic. There's fewer resources available. So again, people are being asked to do more with less. The other piece of the pandemic that we're still sorting through is the isolation. Initially, people were isolated for safety reasons. And now people are learning how to interact again, be back together. Many liked some of the flexibility that the remote work offered, and so there still is a sense of isolation and a lack of collaboration. And I think education and healthcare were hit particularly hard. There's been a loss of what previously there had been a sense of trust and a sense of respect given to education and to healthcare, and societally, really for unknown reasons, that lack of appreciation, that lack of recognition, despite people in those sectors going above and beyond, feel a lack of appreciation and a lack of recognition. Next slide. And then the other piece of the pandemic is really all of these external factors with work-life balance. There used to be an ability to separate, and those lines were very blurred. And so people are sorting that out again. What does work-life balance look like? Lots of personal concerns, lots of family concerns. So all of this put together, really, it's not surprising that we have this mental health crisis that we do in society. I think one of the most important things to let you all know is you're not alone. When you're feeling like this, you often do feel alone. There is sometimes a stigma attached to having mental health concerns. we're trying to really raise the curtain on that and to help you feel empowered to address your own mental health needs and those of your colleagues. And in our next section, we're going to go over some kind of tips for coping before we break out into our breakout groups. We'll pass that along.
All right, I'm going to talk here just a little bit and really just want to echo what Dr. Hingle just said and some of what Jessica Ulrich said as well. And if you leave here today knowing one thing, it's that, it is normal to feel anxious and to have some of these symptoms. Mental health issues were on the rise before the pandemic. And as you see, the impact of the pandemic increased this even more. And, when you think about anxiety, it makes sense that really impacted it because our system of higher education, like Dr. Hingle said, was upended in the course of just a few weeks. So everything as we knew it changed. A lot of us shifted online right away or went home, felt isolated, and there was a big loss in terms of what we considered to be our normal routine. And in any situation that involves kind of loss or the unknown, and when we can't control the outcome, what we can look at is how do we control our responses to it. And so we're going to talk about some of those tips today. But I think it's really important at first to just normalize the fact that all of us are under a lot of stress. Looking at the student population, over 50%. And like Dr. Hingle said, it's headed in the right direction. It's come down just a little bit, but that means more than half are identifying symptoms of anxiety and depression. And so, I think it's important that we work and strive for resilience so that we can bounce back. But that we learn how to thrive in the face of some of these challenges. A lot of the people on this call and that'll be looking at this are also student leaders, but I think it's really important to recognize that even as a leader, you need to look at, how you are dealing as well. You first have to kind of be able to look within. And so, in order to help others, you have to first be able to help yourself. And so I think that it's really important to look at what are some of the signs that say, I might need some help, or a friend might need some help, or a fellow student might need some help. While we're wired to feel fear and anxiety, especially when we're dealing with times of uncertainty, which we still are, it's easy for those to kind of cascade into what we talk about as catastrophizing, overgeneralizing, and responding more emotionally. And I'm going to talk more about that here in a minute. But do remember, when you're looking at your peers' responses or your own, this is the first time we've ever dealt with a pandemic of this magnitude. And I think that it's really important to think of, no matter where you are in your schooling, you had about 2 to 3 years of schooling disrupted, whether that was staying at home and taking courses online, whether that was being isolated from peers, whether you were having a college experience where you're taking classes while living in a residence hall while not being able to interact. It wasn't what we would consider a typical schooling experience. And so I think that it's really important that we're patient with ourselves and look at how do we even reintegrate into what we call kind of a new sense of normal. Next slide, please. All right, so some of the strategies, and one way to really, when we're dealing with kind of those emotions or anxiety, one is to really focus on the facts and stay informed of the literature. So for example, if we're going to talk about COVID, looking at what the CDC says, looking at the World Health Organization, and looking at the Illinois specific information on the Illinois Department of Public Health. It's important that we look at this and that as leaders, as student leaders, you take a balanced approach to staying informed. So oftentimes it is not necessarily a bad thing. We are informed by social media. We might see that something occurred there, but that's only one source of information. So make sure that, while you're seeing things on people's social media feeds, that you're also checking that out, checking out the resources at your organization, checking the facts and making sure that we're dealing with the facts as opposed to kind of this game of telephone that can happen sometimes on social media. The other thing is to know the institution's resources. And we're going to talk a lot about that in the second half of this. And being willing to seek support when necessary. It really is a strength to be able to seek some of the resources that are on your campus. But I think that it's important first. One of the questions that came up when meeting with all of you and putting this workshop together is, how do I know that I might need some help or that a student might need some help? If you notice that, hey, you're having a hard time getting to class when that's not typical for you, or you're noticing that one of your classmates is missing a lot of classes, or you're not really enjoying activities that have typically in the past been enjoyable for you, or you find yourself kind of isolating from peers, or see somebody in your friend group that usually is very active and interactive with you that's not wanting to be there anymore, that's being more isolating. If you notice that you're sleeping too much or too little, it's important that we're looking at kind of a balanced approach when it comes to sleeping. Same thing with eating. Are we eating too much or too little? And basically, also one thing that's really been looked at more closely, and we're going to talk about that a lot in the breakout rooms, is having trouble getting your basic needs met. It's really hard to focus on school if you don't know when your next meal is going to come, or you don't know where you're going to sleep that night, or you have classmates that don't. And so one thing that's really, really important in managing some of these fears and anxiety is recognizing when you're experiencing it, and then being able to look at the different resources that are available on campus. The next thing that I would say is it's really important to stay connected and be empathic. It's often easier, and I'm going to say this multiple times, to be more empathic towards others than yourself. And I'm going to really state that it's important for you to understand that you've been through a lot as well. You're going through a lot of these changes and this uncertainty, and social support is important. So, you know, when we talked about in the pandemic, it's really physical distance we were trying to get instead of social distancing. And so I think it's important that you're seeking out that support, even if some of it is virtual. If you're still not comfortable being in close proximity of people, being able to have strong social support. And that means really connecting with people that you're close with, that you find supportive to you. But sometimes that also means letting go of relationships that might be toxic to you. You know, balancing that out is really important. If there's people around you that are constantly negative or toxic to you, you might limit the interactions that you have with them to really balance that out. I think it's also important to be really open-minded, especially when you go through something as polarizing as the pandemic has been. You know, people have been through many different hardships based on the pandemic. Some people might have lost family members to that, and they're dealing with grief and loss issues. The pandemic, they might view it very differently. And so I think it's important to be really open and accepting of opposing viewpoints, but also to be understanding that your viewpoint might have changed during that time based on your own experiences. What you viewed initially might not be how you view it now, and that's okay. So with different stressors, we're going to view things differently. Next slide, please. The other thing, as we were talking about before, is to remain realistic and think, go back one, please. Yep, keep things in perspective. So when I was talking about kind of that overgeneralizing or catastrophizing, you know, we need to really look at not to do that with everything that's been post-pandemic. For example, if someone has a cough or a fever, it doesn't necessarily mean that they have COVID or that you've been exposed. Or if you're feeling stressed and overwhelmed, it doesn't mean that that's necessarily going to last forever. And so I think it's important that we really stick to what we're feeling in the moment and how do we address it. So be aware of those behaviors and attitudes that you're having towards yourself and others. And then examine if there's any irrational or rigid thoughts that are existing, because negativity can spiral. So when you think in those ways that it's never going to go away, it's always going to be here, that can really lead you down into a really difficult place and a negative cycle. So it's really essential during that time that you're working, and we're going to talk about this a little bit more, to maintain healthy habits. But again, it's really often easier to be kind to others and accepting of others and say, yeah, well, it makes sense that they're struggling. They've been through so much, but we beat ourselves up. And, you know, when you're doing that as a student and you're beating yourself up for not doing well, that can really feed into that negative cycle, because then you're another person that's kind of holding you back or holding you down in an additional stressor. Next slide. Another thing that I think is really important to note, and this is especially true as we're kind of transitioning to the new normal post-pandemic. One of the things that was really, really difficult during the pandemic is we lost our sense of routine and healthy habits. So, well, you as students might have been used to, okay, I get up and I have this routine and then I go to class. We lost that, right? When you're sent home, that routine that you have was really thrown off. And so it's really important during times of uncertainty to focus on kind of the things that are within your control and to build structure into your day. So now that we're kind of building this new normal, build structure by building a routine or a schedule that can really help with anxiety.
Hello.
So also building in things that are pleasant events. So things that can really help with anxiety and depression would be things like taking a walk, getting some exercise, getting fresh air, meditating, eating nutrition. Again, it goes to balanced sleeping and eating, and doing things that you enjoy. So if you're in finals week, that's coming up here soon, and you think, gosh, I have so many things to do, I have to study. It's really important that even if it's a small thing, you build in some things that you look forward to in each day, because it's really hard when you wake up in the morning and all the things that you have to look forward to are tasks. So really trying to build in time to connect with others, even if it means that you're studying together or just checking in and holding each other accountable for getting your work done, and really focusing on some of those things with self-care. But part of self-care is building in some things that you enjoy in each day. Next slide. The other thing is empowering yourself and others to reduce risk. So with that self-care, it's not just building in the positive, it is doing things to reduce your risk of getting sick or getting COVID or some of those things that are leading to that anxiety. So we've really talked a lot during the pandemic about some healthy habits to get into, whether it be frequent hand washing, covering your mouth and nose when you're coughing or sneezing, avoid touching your face, and stay home when you're sick. I'm hoping that you're much more encouraged now to stay home when you're sick than pre-pandemic. The other things that can be really helpful during these times is limiting substance use. So when you notice that you are feeling anxious or feeling some depression symptoms, really limiting substance use during that time can be very important. And also seeking medical care when it's warranted. So when you're sick, go see the doctor and take your medications as prescribed, because that can really help to reduce your risk and add to that self-care that we were talking about. The other thing is that it can be really important to help others that are displaying this distress. So we talked about ways that you might be able to identify that, but it can also be really helpful to you to be able to help others that are in need. So really in these times, demonstrating compassion and withholding judgment for what the other student is experiencing. Also for yourself, if you're going to seek out resources. There's going to be a wide range of how people have coped with the pandemic, how people deal with anxiety, depression, how people even deal with a day-to-day stressor like finals. So try to really listen without offering solutions and be reassuring to others that there is help and support out there. People often benefit from just being heard, and that can have a calming effect. Oftentimes I hear students say, well, I didn't really do anything, I just let them talk to me. Well, that in and of itself can be really helpful to have somebody to talk to have somebody to vent to. But realize those limitations. So when somebody is talking to you and you realize, gosh, they're really depressed, they really need some support, or I myself are really depressed, being able to refer somebody to the resources. And we're going to spend a lot of time now in this last kind of half hour talking about what are the resources on your campus, and you'll get to meet some of those providers of those resources here. And so I think that those are just some quick tips. Obviously, you need to go into those a little bit more in depth, which we're going to do here in a minute. But if you have one thing before these breakout sessions, just remember that this is normal, that lots of you are dealing with this, and we're going to talk about some of the resources that are available.